Hello, I'm Dr. Jeff Sessions from Lake Oswego, Oregon. I'm a practicing orthodontist. We're a suburb of Portland, Oregon. And this is kind of a common thing that happens. So when patients finish treatment, we almost always will give them a clear retainer. It looks kind of like Invisalign, but it's a clear retainer. And it snaps over their teeth. I don't have a model with me right now, but it snaps over their teeth. And sometimes weeks or months later, a patient will go to their dentist and they'll get a new crown in the back of their mouth or a new filling in one of their bicuspids, their molars. And they'll go to put their clear retainer in, and it won't fit over the new crown or the new filling. Oftentimes new crowns are subtly different shape or sometimes dramatically different shapes, and their retainer will not fit over it. So what they often do, and this is what we don't want them to do, is they'll just not wear their retainer until they can see me, and sometimes that's weeks later, and sometimes their teeth will move, and we don't want that to happen. So what I'd like patients to do, and we tell them to do, but they often forget, is to take a pair of scissors, and in the short term that you can get away with this. You don't want to go month after month or year after year with this. You need to eventually see me and have me make a new retainer. But in the short term, if they have let's just say they had a crown done on a molar in the back, I'm tapping with the scissors. Let's pretend that's where the new crown is. You literally take a pair of scissors, and we have special scissors here. But I'm going to take a pair of scissors, and it's kind of awkward, but it will do in a pinch. I'm going to cut it right in front. I'm gonna make sure I don't cut the opposite side, right in front of where the molar is. And you wanna cut it so that there's not real sharp pokey things, but I cut it just ahead where the molar was. So I'm gonna get that piece that went flying, and this is where the new crown was done. Let's just pretend that's where it done. I cut it between the teeth, or ahead of it, and now the retainer can actually fit over the other teeth, and the crown is just sitting there alone. So in a pinch, this will work real nicely. Now, if you left any rough spots, you'll just take a nail file or emery board and just file it down with the sharp corners. But this will do in a pinch until you can see your orthodontist. But you do want to get to your orthodontist rather rapidly because likely want to remake the retainer and have it cover the new molar. But for a week or two or three, this will keep your rest of your teeth straight so they don't move until you can see your orthodontist, because this is much better than not wearing a retainer at all. Thank you.